So practically speaking, you get a rhinoplasty. I'm sure you'll tell us a little bit about the healing process a little bit later, but what do you end up with physically? How are things different for you?
Okay, so the aim of my surgical practice is to give you a nose which feels natural part of the rest of your face. So in my definition, there isn't a perfect universal nose. The nose that is perfect for you could be completely different from the shape of the nose in a different person. The idea is that the nose that we reshape for you is in sync with the rest of your face. So at the end of the surgery, as a general rule, you will have a nose which is straight, smooth, has got a tip which is in alignment with the rest of your nose, and equally importantly, I always do a septoplasty so that you just don't have a pretty nose, you also have a functioning nose through which you can breathe quite well. If you had a blocked nose beforehand, you will have a better breathing at the end of the healing phase in my hand. So the bottom line is, you have a nose which is in sync with your face, you have a tip of the nose which is in sync with the rest of your nose, with the rest of your nasal profile, and you are able to use that nose to breathe without any blockage.
That's really interesting because I actually have challenges breathing, and I didn't realize that you could sort of separate that out, that you don't necessarily need to have an aesthetic concern, that you would actually have a functional concern and come for, you said it was a septoplasty, is that right?
Septoplasty or a septorhinoplasty.
Okay. So is that something that you have patients coming to you for, just for that?
Yep, there is a proportion of my patient who are primarily concerned about breathing through the nose and who would benefit from having a functional septorhinoplasty as opposed to a cosmetic septorhinoplasty. So when someone has a nasal obstruction, there can be many reasons for it, but one of the common reasons is that they might have a deviated septum, and that can be corrected with a simple septoplasty without altering the appearance of your nose outside. But there are also a group of patients, particularly if they have had a fracture or trauma to their nose, in whom having a functional septorhinoplasty would not just straighten their nose, but would also help them breathe better. And if they have private insurance, these are usually covered through their private insurance. So the key thing here is, if you are struggling to breathe through your nose, you might benefit from a rhinoplasty. So the first thing for you to do is book up an appointment and get a complete nasal assessment done by an expert surgeon.
Hi, if you're unsatisfied with any aspect of your face, as many of us are, I invite you to take our assessment below. What you'll be doing is answering some questions that we've asked you about how you feel about your face, and we'll even invite you to submit a selfie if you like. And from that, we'll be able to come back to you with some solid suggestions on what you can do to address some of the concerns that you might have. So I invite you to take our assessment now.